And welcome back to AM Buffalo. This morning we're talking about transitions in our Great Look Monday. Sharon Lawerence, registered nurse and certified dietitian, nutritionist. And the transitions program is going to be taking place at the Westwood Country Club, and that's on North Forest, coming up Wednesday, excuse me, the 22nd. That's next week. It'll be from 7 to 8:30 p.m., and you need to RSVP at 839-1700, extension 100. And, of course, it's sponsored by Dr. Sam Shatkin, Jr. Well, we're back to our program here. I've got to ask you something, Sharon.
Sure.
The thing you're going to run into the most, the biggest obstacle you're going to run into is people staying inspired, staying on the program, because if you think about your favorite TV show, your favorite movie, that you say, oh, I could watch that over and over and over. Well, after about 4 or 5 times, then I'm not going to watch it anymore.
It's boring.
It's easy to get bored doing exercises and working out. How do you keep people inspired?
You inspire them by using a program that actually works, a system. And when weight is not the issue, and they don't have to worry about the scale, and they begin to fit into their clothes, that is very inspiring to anyone. It makes them stay motivated. Plus, we have certified coaches like Robbie Ra from Bailey Total Fitness.
Remember Robbie, haven't seen her in a long time.
She's going to be rolling out Sam's next program.
No
there at
kidding.
Aesthetic
Boy,
Associates.
I'll tell you something. There is somebody who looks like, when she's standing still, she looks like she's running. I mean, she really does. You brought a before and after picture of someone who's been through the transitions. Now, folks, don't try to look real hard and think, oh, I wonder if I know this woman. This is a national picture. Right. It's from someone somewhere else in the country. But look at the difference.
Well, the whole point is this. You know, you can see not only is her shape better, but her confidence is better. And that's exactly what the Lifestyle System program does. It makes people feel so much better about what they're doing and how they feel about themselves. And like Sharon said, it's not just about what you look like on the scale. It's about how you feel. And I can tell you one thing, with proper nutrition, you will sleep better at night. You'll have more energy and be more invigorated the next day. You'll go through a full day without getting that tired, sleepiness. I mean, every part of your life will be so much better, and you'll live longer too. I mean, that's just sort of a nice side effect, of course. But it is about the whole package.
It's true. It's about personal power and regaining it. Because otherwise, food is the enemy, and that's ridiculous.
Yeah. We have our first call. Great. Good morning. Welcome to the program.
Good morning.
Hi.
I was wondering, do you believe if your mother or father were overweight, that you would have a tendency to have this problem too?
Oh, I guess we're talking heredity, genetics, or whatever.
Yes, genetics plays a huge role. However, anyone can change their life. And so for the caller, please know that that's not a death knell. That's not a life sentence just because a parent or both parents were obese or battling weight issues. You can attack that. You can get ahead of it. You don't have to worry about that. Just do the little things each day that make a difference.
Yeah, I think it's just a matter, you have to work a little bit harder maybe than the average person. And that happens throughout life. It's not just about, when you're younger, your parents, like women, for example, that are reaching their menopause years, their hormones change, and we don't like to blame things on hormones, but it is really what happens. Yeah. And you really need to try to work a little bit harder or do a little bit more. When kids are young, they don't have to worry about that. But when you get older, that's something important.
You have to be smarter. So instead of reaching for a glass of orange juice, you reach for the orange, because that's low glycemic. You do the little things that make a big difference.
You mean because processed orange juice has added stuff in it?
No, it's because when a food is whole, an orange has fiber in it.
Okay, well, of
Lentils, split peas, anything that comes naturally with fiber, all fruits and vegetables. These are wholesome foods. They don't cause your blood sugar to escalate quite as fast. So they don't turn on a switch that causes fat storage.
Okay. Now, Sharon, I've heard something. I want you to tell me if I'm right or dispel it if you can.
Go ahead.
That there are 2 kinds of fat cells. There are fat cells that you are born with, and then there are fat cells you take on with improper eating. And the fat cells you're born with, if you don't get proper nutrition as a baby, a child growing up, those are the permanent fat cells that you have the hardest time controlling. Is this true?
Sam, why don't you
or maybe this is a question for Dr. Sam.
Right. Basically, the way it works is this. We're born with a certain number of fat cells. Those fat cells can expand or contract depending on what we do with our weight and our diet. So the goal should be just keep in good, healthy condition. So it's not like we add more fat cells through our life. But I have that question asked all the time with patients that have liposuction. Am I going to get more fat cells again? You don't get more fat cells, but you can certainly enlarge the ones that you have.
You can always fill them back up.
You can fill them back up, and then you end up with, you know, this I can't even pick it up. It's so heavy. This is 5 pounds, and it's a lot of fat.
That's just ugly.
And worse, if you diet improperly or you yo-yo diet, those fat cells will fill up faster and faster on less calories.
Because you're expanding them.
Because if your metabolism slows from dieting incorrectly, you will lose the lean muscle tissue that drives metabolism. The goal of healthy eating and losing weight is to preserve your lean muscles everywhere, your quads, your arms, because if the muscle mass shrinks, your metabolism shrinks, and when you put food in your mouth, it'll be burned at a slower rate, and you will wear the calories.
That's the problem.
So that's the problem.
So part of the transitions is telling people the kind of foods to eat to stimulate the metabolism.
Exactly, and control it, and keep it safe and healthy. The times to eat, how often to eat, what to eat, when to exercise, how often to exercise.
Yeah, I've run across a lot of people that are so surprised they find out that sometimes the proper diet is you're not eating 3 meals a day. You might be eating things in between meals that you thought, oh gosh, if I'm on a diet, I can't eat in between meals. But if it's the right thing, it's going to work.
It controls blood sugar. That's exactly the goal.
You know, people go on crash diets, and I have patients that come to my office and say, Dr. Shatkin, you know, I don't understand why I can't lose weight. I don't eat breakfast. You know, I try to just have a cup of coffee in the morning to try to get my metabolism up. I mean, that alone, when I talk to them about their diet, they start with breakfast. I say, well, let's stop right there. Let's try to get you on track, because that's not a healthy way to do it. And if I do nothing more to them, then get them on the track of eating healthy. Even if they never have surgery, they're going to be better off when they leave my office, because I got to tell them to eat those 3 to 5 meals a day and the right snacks when they need them.
All right, we have another phone call. Good morning. Welcome.
Hello?
Hello, yes.
Hi, I'm asking about a condition called metabolic syndrome that I was diagnosed with, and it's stated that it's caused by plastics. They're blocking use of a hormone. I wanted to know what they knew about this and how I can get the plastics that are already in me out of my body.
Did she say plastics?
Yes, it's caused by plastics.
No.
It was in the paper recently that there's even a blood test and a urine test for it.
Well, talk about the metabolic syndrome, Sharon.
Metabolic syndrome is actually very common. It's the syndrome that is created when excess fat accumulates around the middle. We call this the apple shape as opposed to the pear shape.
Yeah.
And all of us that carry fat, the visceral fat, the fat that lays under the skin around our middle, are at risk of metabolic syndrome. That's what we were talking about a little earlier when we talked about as soon as you lay down these visceral fat stores, blood sugar begins to climb, triglycerides, cholesterol, blood pressure. And the way to approach that is exactly the way we've been talking about today, with healthy food choices, staggered throughout the day, with becoming accountable to yourself and to a coach, exercising, practicing good stress management and affirmation techniques so that you get a handle on stress, getting proper sleep, because when you don't sleep enough, you will gain weight. Your cortisol levels rise, and then it's harder to lose weight.
All right, well, I'm sorry we're out of time, but then we want to leave something for people to find out at your seminars here.
Okay, now my seminar is not on transitions. It is about using nutraceuticals and wellness, proper weight management techniques, but also if someone's in pain, has inflammatory diseases, autoimmune diseases, I'll be speaking at the Westwood. Everyone can come. It's October 22nd from 7 to 8:30. And Sam, would you give the phone number?
Just call our office at 839-1700, and we can help you set up an RSVP for that.
Absolutely, we'd love for you to come.
Want to thank both of you for being with us this morning and helping us look better from the inside out.
Thank you, John.
And you can find Aesthetic Associates at 2500 Kensington Avenue in Amherst. As Dr. Sam said, give them a call at 839-1700. And the preceding segment was brought to you by Dr. Sam Shatkin, the Aesthetics Associates Center.
The preceding segment was sponsored, and portions of the AM Buffalo and Buffalo Weekend programs are sponsored. The opinions expressed do not necessarily reflect those of WKBW-TV or the host.